Welcome to Brain Power with Dr. Echo, where each week we discuss how your family can boost brain health by addressing mind, body, emotional, and environmental health. And now, here's the episode.
Hello, parents. Welcome to another episode of Brain Power with Dr. Echo. I have an amazing guest today. Her name is Dr. Dona, and I'm going to have Dr. Dona introduce herself as always. So, Dr. Dona, welcome to the show.
Thank you so much for having me. I'm so excited to be here. So, my name is Dr. Marie Donna. I'm a child, youth, adult reproductive psychiatrist and therapist, but I also got additional subspecialty training in obesity medicine as well.
Oh,
So, that
wow.
was another additional certification that I just got within the last year or so. Yeah. And I have my own private practice in Riverview, Florida, but I see patients within my practice all throughout the state of Florida, New York, Pennsylvania, and Washington, D.C.
Wow. That's amazing. Well, thank you for coming on here. And it sounds like you have quite the expertise. Oh my gosh. I didn't know you had the obesity and the reproductive. Wow.
Yeah. I mean, I feel like it's a thing, like, when as doctors, right, you're always wanting to you're always doing CMEs, continuing medical education, and you're always wanting to learn, and I felt like that was just kind of part of it, so that's when I just kept, like, tacking things on, but I feel like it's all beneficial, and it's stuff that I can apply towards my practice.
Yeah, definitely. I mean, it makes sense because you're an adult psychiatrist and then you have reproductive. So if you have mommies, you can take them.
Yeah.
And then the adolescents too need reproductive care as well. I mean, from a mental health standpoint. So it all makes sense. So congratulations.
Yeah.
I love it. So today we decided we were going to talk about the comorbidities around ADHD and autism, especially in kids and even
Mm.
teenagers. Teenagers is a big one, yes. So,
Mhm.
let's dive in.
Well, definitely as child youth psychiatrist, I will say so. ADHD and autism, they are, mental health conditions that definitely I think are very important to be properly diagnosed and treated as young and as early as possible. Just because, as you just mentioned, the comorbidity, like, the likelihood of someone eventually having another mental health condition, depression, anxiety, mood swings, all of the above, it just goes so much higher when someone has a diagnosis of ADHD or autism. So, I mean, I can even give you statistics. So, for someone who has been diagnosed with ADHD, like, yeah, as a child, the comorbidity of both depression and anxiety can be anywhere from 25 to 50% of them having dual diagnosis. And as you can imagine, if someone has depression, anxiety as a young child and it goes undiagnosed or untreated for years, like, how the severity of that disorder can just continue to manifest and potentially get worse as they're getting older into teenage years and adulthood years. So that comorbidity actually goes up. Like, if you have ADHD or autism and have untreated diagnosis of depression or anxiety, it goes up to like 50 to 75% of comorbidity of depression and anxiety. Like, so there's definitely an interplay between those diagnoses and other mental health conditions.
Yes, and I think that's important. Those statistics are staggering, first of all. So it's really important for parents to understand it and to recognize that it's not that their child is willfully not listening, willfully not wanting to go to school and just being a brat. No, because all of these things could be happening at the same time. And if we don't recognize that, then we're just going to not give them the help that they need. Right?
Yeah, yeah, definitely. So something I hear all the time, and I'll give an example for ADHD specifically. So, with ADHD, within the DSM, it's diagnosed as like the inattentive type, the hyperactive type, or the combined type. So then, when people are thinking about ADHD, they're thinking, oh, super hyperactive, or, very inattentive, forgetful, daydreaming, etc. But, what isn't really talked about as much, or, people don't find out until later, is that behavioral component or the mood component of ADHD. So when I talk with parents of kiddos with ADHD and they're like, oh, yeah, like, not paying attention, or they're very hyper, but, oh, like, I think it's just laziness when they're not listening to me, or, they're doing things without kind of thinking about the consequences. Like, is there something wrong with it? I'm like, okay, well, with ADHD, while there is the inattentive portion and the hyperactive portion, like impulsivity, that lack of impulse control is a huge thing, with the brain, the brain connection. Like there is that disconnect between, okay, let me actually think through the consequences of my actions, behaviors, or, oh, I want to do this, or I'm going to react right now. I'm just going to do it. And then that's when it kind of leads to issues. So I like to help parents try to think of it and reframe it as, okay, not just forgetful, not paying attention or hyper, but just the way that they can interact with the world. Like impulsivity. I'm upset. I'm going to throw my toy across the room and it might break the TV. Oh, now you're acting out. You're in trouble. Defiant, just a behavioral issue. No, it's a little bit more nuanced than that, just because they are not understanding, like, okay, I need to take a moment to understand where my emotions or anger is coming from, to maybe stop from just thinking I'm angry to throwing the toy. And that's where a lot of behavioral intervention comes in when it's coming to ADHD or impulsivity or these types of behaviors.
Wow, that's wonderful. Thank you for explaining that. And so, what do you tell parents when they come to you and their children have these issues?
So when parents come to see me, I like to really get a good background about their history, kind of how they do things, like basically from childhood to current, well, birth to current, like, birth history, medical conditions, family psychiatric history, all of the above, because these can definitely affect, a kiddo in their terms of their behaviors. If there is trauma, abuse, these are huge things that can affect, a kiddo and their behaviors. So I get a really thorough background, information, history. And then once that's obtained, then I'll kind of ask, okay, like, well, what is going on nowadays that's bringing you into seeing me? And I will say, as a child adolescent psychiatrist, a lot of times it's either behavioral concerns, acting in a school, acting in at home, or, issues with attention focus, that it's actively contributing to them having issues with performance in terms of school. So then identifying whatever that problematic issue is, and then seeing how they've addressed it so far. A lot of times they'll be like, oh, haven't really done anything, or screen time. So then that's when I would usually start talking about intervention. So child adolescent psychiatrist, I am, an expert in prescribing medicine, but I will always say, I always recommend behavioral interventions first, therapy, PCIT, play therapy, other types of things, to come down to actually find out the root or the cause of the behavior, so that's where you can potentially, do things like reward charts. Reward systems are things that have a lot of evidence base for being helpful for kids who have been struggling with behavioral management, behavioral regulation. And a lot of times parents just aren't familiar with that there are things out there like that can be helpful with their kiddo. So those are all things that I would recommend as first line treatment. And then typically when I would start recommending medicines is after they've already tried behavioral interventions and they haven't been working, or it's kind of plateaued, or behaviors have really escalated that, it can progress to like a safety concern. And then that's when medicines really become more of a topic of conversation.
Right, right. That makes complete sense. And thank you for walking us through that. And so what would you say for parents? Like, how would they handle things at home? How do they talk to their child about what's going on? Because I think that's a big
Yeah.
issue that parents have.
Yeah, so usually I would recommend for parents to just have like an open and honest kind of discussion. Like sometimes parents might not give their kids enough credit to have an understanding of what they're feeling, and like sometimes they might kind of just assume like, oh, they're just angry, or they just have issues. But then just actually sitting down with your child, okay, like, is there something going on? Is there something bothering you? Like, are there issues at school? Is someone bullying you, or are you having a big thing that I've noticed with kids with ADHD and even autism is that behaviors can manifest when they are frustrated with schoolwork. Like they're not understanding how to do the schoolwork. They're not able to focus. They're not able to concentrate. So they get frustrated. And the only way that younger kids are able to, show that they're frustrated is by acting out, getting angry, throwing things, breaking things, yelling, screaming, those types of things. And then, yeah, parents might think, oh, my kid is just being a bad kid, when underlying, oh, no, they're actually really having trouble reading for an extended period of time, or they're having a lot of trouble with math. So, just I think, really being open to discussing with their kids, like if there is something bothering them, and then taking their cue from there. And then, getting input from the school, I think is also really important too, if teachers are having any specific concerns. And then, yeah, trying to navigate from there.
Right, right. And no, that those are really important points because I think that even a lot of the work that can be done to help the children has to start at home. And so it's really important
Hmm.
the kind of environment. So when when you're talking about teenagers and you ask them how's your day and they say fine. So how do you recommend to parents to get past the fine thing, fine answer and get to the to the real crux of the matter?
So I'm going to say teenage years, prepubescent, like preteen years are very difficult when it comes to communication with kids. Because I will say honestly, and I have this conversation with parents all the time too, in that like as much as you want to be that go-to, that person that, your teenager is going to confide in and talk to during that time period, it's almost within developmentally normal for friends like that support group to just kind of top the teenagers in terms of like who they're wanting to open up to or talk to. So this is where, okay, it is normal that, sometimes your kids might not be wanting to go to you first, but this is where I say willingness to open the door to communication. Okay, like I know that you might be just wanting to hang out with your friends or do this or that, but I'm always going to be here for you if you need anything. Or, just let me know if there's any way I can support you. And I also think, willingness, yeah, to open the door to communication, being vulnerable too. Like, so ADHD is a diagnosis that there is, high likelihood that it's heritable, like genetic. So a lot of times kids with ADHD might have a parent who had ADHD. So, if a parent themselves had ADHD saying, yeah, I've kind of struggled with the same things too. So if this is something you're going through, let us know so that we can try to help you. And just kind of keeping the door open like that, letting them know that they will always kind of have a support. Boundaries are a thing too. So, as much as you want to be support, like if someone is obviously acting out, etc., like there still needs to be boundaries in place. But I think, just ultimately letting your teen know or, your kid know that you are there to be a help or support if they're needing anything and just trying to follow their cues essentially. But it is a difficult time in terms of communication. I think just worldwide during this time frame specifically.
Yes, I have one in my house, so I know.
Uh,
I have a I have
yeah.
a
Yeah.
10-year-old and yes, I'm like, what happened to my kid? Okay, but yeah,
Hmm.
sometimes it's the fine, no, yes. I was like, okay. So I get it. And yes, parents, you're not alone. There's resources to help you walk through how to
Yeah.
get to your kids and just to get them the help they need. But it's so important. I think I like what you said about, for me, I like to say it as speaking life to your kid and just reminding them who they are, who you see them as, who, and that you love them, even when it feels like you can't reach them. They are listening.
Mm.
And I found my own limited experience, especially when it's like, when she's acting like, oh, she doesn't need you. She really does.
They still need you. Yeah.
Like, yes. And when you just keep being consistent and telling them that you love them regardless of the behavior, it doesn't mean you're condoning the behavior, but they still need to know their love because that's like the bedrock foundation. Because if anything is gonna pull
Hmm.
them out of that, it's gonna be that they know their parents love them. So I think it's important. Yeah.
Definitely. So I've heard, from all ends of the spectrum. So I've actually had families I've worked with that, they've gone through the teenage years, but then they've seen the other side of it. It's like I've had also patients that themselves, like I remember like, oh, I actually talked with my mom and I was like, yeah, mom, dad, why? I don't know why I didn't talk to you for like 4 years, but like all of a sudden this like light bulb goes off and they're like, I have no idea why I didn't want to talk to you for 4 years, but
That's good.
I guess it's okay now. And then now they have a good relationship. But I would say, like, this is honestly where I think it is within the realm of normal. But like everything you said, showing that you love, care, support them, kind of regardless if they need anything. But, also understanding that this is a time that sometimes they are kind of wanting and needing their distance to you, but just knowing it's not anything that you are doing as a parent. Like, it's just something that does kind of happen within these developmental years.
Yes. And so what would you say to those parents who they go to their healthcare professional and they're not quite able to get the help or support that they need for their kids. Maybe it's, oh, it's just normal. They'll get through it. What are the questions or what kinds of things should they be saying to their providers to get the help they need?
So I guess this is where a lot of times it can be normal, but at the same time too, some of these things might not be as normal. So I know that a lot of times when kids, teenagers might be seeing their pediatrician or PCPs, they'll do kind of screening exams like GAD-7 for anxiety, PHQ-9 for depression, like those types of things. So this is where, taking those questionnaires seriously, and if they're scoring high enough on the threshold, talking, having the kid talk with their PCP or their pediatrician about these issues. And I will say, so I work in a lot of different, so I have my own private practice, but I also did a lot of like emergency, like child, adolescent, teen ER work. And it's kind of funny how like sometimes the teens won't want to talk with their parent about the issues, but then they will meet me, a complete stranger, and they'll feel like because this is like, someone who is completely unbiased outside of the relationship, that they can be open and honest. So if this is where, parent is concerned, they can always, I think I would still encourage them, to bring them in for an evaluation. And like, if they're, preliminary screening, PHQ-9, GAD-7, talk isn't raising any red flags. That's where, pediatrician, PCP, psychiatrists can provide that reassurance. But, if after a conversation with their kid, there are additional concerns, that's where it might be warranted for a further evaluation and potentially having their kiddo talk with another mental health provider.
Yes. And parents, I want you to know that you're the first and best advocate for your child. So even if there's a screening form and based on the way you answer it, it doesn't quite, your child doesn't meet threshold, it's important for you to be honest with the doctor and say exactly what's going on, because that's the only way you're going to be able to get the referrals as need. I mean, depending on what's going on, what your insurance and all of that is, to get the help that your child needs. So it's just, don't be ashamed of it. It's nothing to be ashamed of. It's important that your child gets the help they need.
Yeah, and like so while we're talking here, like we are both medical professionals, right? We're kind of familiar with like within the norm and what's not, but like parents, like it's okay if you don't know exactly what is normal. That's why it's okay to reach out for help. Touch base with your doctor, touch base with your pediatrician, PCP, and ask the questions. Bring up behaviors, and that's where they can. Not every case is the same, right? So there's different scenarios, different situations, and that's where your medical professional can advise you one way or the other.
Right. Absolutely. Wow. So I like to ask all my guests like to give us like last minute brain health tips for both the parents and the kids. So do you have any you'd like to share?
Last minute brain health tips. So I'm all about psychiatrists prescribe medicines, but I'm all about, the holistic treatments as well too, like nutrition, like good, making sure that someone is getting healthy nutrition, sleep hygiene as much as possible. And I'm going to say the teen years are especially hard. It's a conversation I have all the time with my patients and clients, right? And physical activity. These are all huge foundational things that there's so much evidence that like, and I'm all about homeostasis too, that if one of these things are off, like bad nutrition, poor sleep habits, limited physical activity. These are all things that will, can impair mental health. Yeah, physical, medical, mental health, brain growth, and overall development. So this is where, people are seeking help. Behavioral interventions, therapy, medicines, but I always go back to the basics first. And like, how's your sleep? How's your diet? Okay, what are things that we can do to tweak here to make them just that much better? And, these are things that like they might seem so small and minuscule, but can make a world of difference in overall helping someone with and basically anything, right? Like any mental health condition, autism, ADHD, like basically everything. So that's my basic fundamental go-to from here.
I love it. So please tell the listeners where they can find out more about your practice.
Okay. Yeah. So my practice name is Dona Wellness Clinic. So you can reach me through our website is www.donawellnessclinic.com. We have a bunch of social media. The handles, it's all Dona Wellness Clinic, like facebook.com/Dona Wellness Clinic, Instagram.com/Dona Wellness Clinic. I am physically located in Riverview, Florida, but yeah, I'm able to see patients virtually all throughout the state of Florida, Pennsylvania, New York, and Washington, D.C. And we are taking new patients now.
Yay, wonderful. So thank you so much. Parents, go check out her YouTube page. If you need her services, reach out. And so thank you so much again for coming on here, Dr. Donna.
Thank you so much for having me. This was great.
Everyone, until the next episode, have a wonderful day. Please share this with somebody that you feel needs to hear this. Take care.